Welcome to The Explainer. Today, we're exploring the absolute cutting edge of medicine. We're going to dive right into how the massive wealth of Silicon Valley is blowing the doors wide open on the next frontier of human health and longevity. It's a real game changer.
Now, you might be wondering, why are the world's top tech billionaires suddenly pouring their staggering fortunes into biotechnology? Well, they aren't just chasing some wild science fiction dream of immortality. No, they're fundamentally trying to overturn the very common sense of medicine and completely transform the daily reality of patient care as we know it.
Okay, let's dive right in. Here's our roadmap for today. 1. The paradigm shift in medicine. 2. Early detection and precision medicine. 3. Aging as a disease. 4. Democratizing longevity research. And 5. Our meaning of life. Section 1. The paradigm shift in medicine.
So think about traditional medicine. Historically, it's been totally reactive, right? We treat sickness only after the symptoms actually appear. But the longevity medicine these startups are building, it's hyper proactive. By leveraging massive amounts of data and AI, the goal here is to pinpoint risks before symptoms ever even show up. It's effectively shifting the role of hospitals and doctors from simply curing sickness to actively preventing it. We're making a huge move toward identifying issues early and treating aging itself. Moving right along to Section 2, Early Detection and Precision Medicine. A prime example of this massive shift is Neko Health, co-founded by Spotify's Daniel Ek. They started with 30 million euros in initial funding and have raised a total of $325 million. And they are completely transforming early diagnostics. They actually use 16 different medical devices, we're talking thermal cameras, 3D cameras, and lasers, to instantly measure millions of data points for risks like skin cancer and heart disease. And the best part? It's completely non-invasive. Right now, there is literally a global wait list of over 100,000 people waiting to get access to this. Crazy, right? But the truly striking detail here is this number, 6.6%. In Neko Health's very first year out of roughly 2,700 scans, 6.6% of individuals were found to have major, potentially life-threatening diseases. Remember, these were people who thought they were completely healthy before walking into the clinic. It's a clear, undeniable testament to how AI-driven early detection is quite literally going to save lives on the ground. And we're also seeing absolutely incredible precision in treatment prediction. Take Ataraxis AI, which is backed by Peter Thiel. They developed an AI model called Kestrel. When you compare it to standard gene testing, Kestrel improves the prediction accuracy of breast cancer recurrence and treatment efficacy by about 30%. Think about what that means in a real-world hospital setting. It means accurately identifying patients who can safely skip painful, unnecessary chemotherapy. It's this perfect fusion of AI and precision medicine that drastically improves a patient's quality of life, all while lowering overall medical costs.
Section 3. Aging as a disease. Treating the root cause. Now, what's really fascinating here is a concept known as cellular reprogramming. Essentially, this is the process of partially returning aged cells to a younger state to reverse age-related diseases right at their source. Instead of viewing aging as just this inevitable, natural decline we all have to face, this scientific perspective treats it as a curable condition. This exact scientific breakthrough is what's attracting massive investments from tech titans like Jeff Bezos and Sam Altman. Over $3 billion. Yes, billion with a B. That is the staggering initial investment Amazon founder Jeff Bezos reportedly poured into Altos Labs back in 2022, making it one of the largest seed rounds in biotech history. And they've got Nobel laureate Shinya Yamanaka serving as a scientific advisor. Altos Labs is fully integrating AI and cell biology to steadily transition from animal models to real-world clinical applications. Then we have Sam Altman-backed Retro Biosciences, which operates on this highly logical three-pillar approach. First, they're dramatically improving cellular reprogramming using an AI protein model co-developed with OpenAI called GPT-4B Micro. Second, they're targeting autophagy, which is basically the body's cellular recycling system, with clinical trials for neurodegenerative diseases actually set to start in 2026. And third, they're developing plasma-derived therapies. It shows exactly how fusing AI with cellular science is accelerating the timeline for getting these treatments into actual clinics. But we have to acknowledge the harsh realities of clinical testing. Deep pockets do not guarantee immediate scientific success. For instance, BioAge Labs, backed by Andreessen Horowitz, had to halt development of a specific drug due to liver issues. Though it's worth mentioning, they quickly pivoted to new inhibitors under a massive $530 million deal with Novartis. Meanwhile, Calico Labs, founded by Larry Page, saw its 11-year partnership with AbbVie end after a failed ALS clinical trial. So these are the rigorous, undeniable realities and setbacks of developing frontier medical treatments. It's not always a straight path. Section 4. Democratizing Research, Web3, and DeSci. We're also seeing the rapid rise of DeSci, or decentralized science. This is a really innovative approach that uses Web3 technology to break down the traditional monopolies that universities and massive pharmaceutical companies hold on research funding and intellectual property. Figures like Ethereum co-founder Vitalik Buterin are championing this system to put the funding and direction of longevity research directly back into the hands of the community. And VitaDAO represents a brilliant, real-world success story of this model. Their community uses a token called Vita to vote on which scientific research actually gets funded, and the resulting intellectual property is managed as NFTs. This alternative financial ecosystem is already producing massive results. They've funded companies like TurnBio, which recently secured a licensing deal worth over 300 million Japanese yen, and Rubido Life Sciences, which raised a $40 million Series A. The very mechanics of how medical science gets paid for are literally changing right before our eyes. Which brings us to our final section, Section 5, our meaning of life. I want to leave you with one final thought today. When extreme super longevity is actually realized, how will our meaning of life be updated? Imagine a future medical landscape where diseases are caught and eliminated instantly, and aging itself is treated as just another manageable condition. When we regularly live out 100 healthy years or more, what kind of society will we actually want to build? This paradigm shift isn't science fiction anymore. It is happening in labs right now. Think about what this future means for you. Thanks for joining me on this explainer, and I'll catch you next time.